10:01, so I'm going to go ahead and start. And I don't know if we'll have all 100 on the call. However, we have that many people registered for the call. So I was pleased to have all of you introduce yourselves up to the point that we got, but I'm going to ask the rest of you to mute yourselves, and what you could do to continue to introduce yourselves is through chat. Just make sure that you're sending it to everyone. Click on everyone and just tell us who you are and what organization you're with, and that'll be great for everyone to see that in there. So I want to first begin by introducing myself. I'm Lee Nasahi, and I'm the President and CEO of VisionServe Alliance. And joining me today as co-hosts are my staff team, Wendy Himes, who is the Director of Conferences and Communications. Say hi, Wendy.
Hi, everybody.
And Ben Lay, who is our Marketing Manager. He's much more than that, but stand-up comic, creative director, and if we end up with dead air, he's going to fill in for us. He's also the man behind the scenes here, and I'm going to just say right up front, this is by far and away the largest Zoom call we have managed, and we are going to do our best. I'll just ask you to be patient with us, and I'm sure as time goes on, we will get better and better at this. We decided to run this meeting as a regular Zoom meeting, not a webinar, which means you all do have the ability to talk to each other, see each other, but I'm going to ask you to please cooperate a little bit. We have maybe 100 people joining us, so I'm going to ask you to stay muted, and there may or may not be an opportunity for you to speak directly, but please use the chat. That's where you can share information, you can ask questions, and in fact, we'll ask you if you already know you have a question or they come up as we go through this. In chat to everyone, type the word question all in caps, and then ask your question or your comments if you want to share. And we will just continue to get better at this as we go along. VisionServe Alliance, for those of you who don't know, we are a 501c3 membership association of private nonprofit organizations and charitable organizations whose primary mission is dedicated to serving people who are blind, have low vision, or other visual impairments. And one of the things that we do is we bring our members together. We're a leadership collective sharing our gifts and talents and resources with each other to strengthen the ability of each one of our organizations to provide services to our mutual constituents. And the purpose of this call, well, when the world changed about 2 months ago, we realized that we needed to start convening some virtual events and sharing resources, learning concerns from our members. So if you're a member of VisionServe Alliance, you probably already know that we offer a number of virtual events, something we call Spiel and Steal every week. We conduct for an hour, and members just talk with each other and share their best ideas. And a lot of the conversation in that meeting centered on the delivery of remote services and how are we going to get back to work when we reopen, what is that going to look like? And we realized that we needed to convene a weekly call, and we really wanted to do it with all of you, program leaders and managers in the field directly. CEOs are welcome too. And in some organizations, the program leader is the CEO. We understand that. But we wanted to have this more focused conversation every week so that we can build the resources and ultimately have best practices. And we'll talk about that. Best practices and perhaps even standards. So today, the format's going to be, we're going to hear from two of our national organization colleague program leaders, Sylvia Perez with Mississippi State University's National Research and Training Center, and she's the director of OIB TAC, and Kathy Zeider, who is the president and CEO of ACVREP. And I will ask them to share a little bit of information in just a moment. And through this whole hour, we are also going to ask you to share a little information with us through polls that we're going to share with you. And of course, we'll share the results of those. And then we'll open it up for questions. So just, it looks like everybody is on mute, and I appreciate that. And everybody is typing in who they are and where they're from in the chat. So appreciate that and keep it up. Just one little thing I'll mention in case you're relatively new to Zoom. Anything you put in chat can be downloaded by the whole group. So be nice. Don't put anything in there you wouldn't want everybody to see. Okay, and let's see, I think we are ready to go ahead and get started. So the first thing I'd like to do is share with you a poll and ask you to respond to that. So Ben is our poll master. Ben, can you share the first poll question? And then I'm going to introduce Sylvia. Can everybody see that and or access it with their screen reader? Shake your heads yes. Yes? Okay, great. So the first question is, which of the following services is your organization currently providing remotely? So there's 8 different choices there. If you would let us know, and we'll come back to that and share the results of that in just a few minutes. Thank you for participating. Very interesting. Okay. So allow me to introduce a longtime friend and colleague, Sylvia Perez, who, as I mentioned, is the director of OIB TAC. I hope all of you are familiar with her terrific training center and what they offer at OIB TAC. If you're not, you're going to want to visit her website. And oh, by the way, we will be mentioning a number of fantastic resources. You don't have to worry about getting the link verbally because we're going to put it in the chat for you, and we're also going to email it to you. So you will be able to access all the resources following this, what anybody's mentioning. So Sylvia, I would like you to just take a minute, and I mean a minute, to try to explain a little bit about what you do at the training center and OIB TAC. And then Sylvia's been already very involved in working with organizations, gathering information from state agencies as well as private agencies on remote services being provided, what's working, what's not, what resources exist, and a little bit about what we can expect from the National Research and Training Center moving forward with the development of best practices in this arena. Welcome, Sylvia. And yep, unmute yourself. Good.
Thank you, Lee, so much for inviting me to participate. And what I would like to say first is we know that in our field, vision rehab professionals are super adaptable and innovative. And now more than ever have we had to demonstrate innovation. And so I want to commend all of you and your teams for the amazing adaptability and problem solving that we have observed. I am really on kind of the outside, but talking with people every single day nationally about what's working, what's not working, trying to help facilitate like problem solving and innovation. And I have to say that I am hearing some tremendous things that people are doing to make it work. So thank you all on behalf of all of the people you serve for just being problem solvers and innovators. I think that we are at a point in history because of this to really take our field and move it forward and modernize it. We know that best practice is face-to-face instruction and training. We know that, but we also know that there has to be a significant place that even as we move into the future, that remote and virtual training can play. And of course, I think that if we can capitalize on that and validate that it really does work, we will be able to reach so many more people. So we've been gathering some data nationally, because we work with all 56 states and territories in the United States and have regular interaction with almost all of those states. And we work with both the state agency and private agency. So if any of you are contracted by your state agency to provide services to the older blind 55 and over population, we have probably had some interaction with you. But if not, if you work with adults, our resources are available. We have a community of practice, which I know is going to be shared, where we have free continuing education courses. We have a wide wealth of resources. Many of that came from you guys or your colleagues, and we now have a folder within there that is specifically remote resources. Some of those we have developed. Some we've moved over from other places that fit to move forward with remote, and some we've gathered from people like you in the field to just share so that you don't have to recreate the wheel. We are gathering data. We hope that you will participate in that, because we really do want to build out some standards as we move forward. We are working on a proposal at the moment, in fact I worked on it today, to put forth to Rehab Services Administration, who's the funder of all VR and older blind services in the United States, for us to convene a working group, a task force, whatever you might call it, to actually build out some standards of service as we move forward. And so it won't just be remote and virtual services, because I think that there's going to be a huge mix as we move forward, especially looking at the population that I focus on, which is the older blind. They're one of our most vulnerable populations, and of course, the one that has the greatest difficulty accessing remote and virtual training. So there's going to be a cross between the in-person, face-to-face training and remote and virtual training. So how do we move forward, and what will those standards look like? But I think we have a great opportunity to really modernize our services and do some great innovation. And I'm counting on all of you and your expertise to help make that happen. So thank you.
Thank you, Sylvia. Appreciate that. That was great information. And as I mentioned at the front end of this, we will provide you with links to all of the resources that we have gathered on this subject so far, and hope that you'll take the time to read through those things and visit the websites where a lot of this information is captured. And yeah, I think we're all excited to see how these innovations can assure that people across America continue to get vision rehabilitation and vision specific education services through this pandemic and beyond. I mean, if you've worked in this field for any length of time, you've been involved in a conversation during which we sort of commiserate about how many people in this country do not have access to services because they live in a rural or remote area. As we all know, there are not ample services available to everyone in this country. So thank you very much for that, Sylvia. Ben, will you please now provide us with the results of that first poll?
Absolutely. So for those that are able to access it, I've just shared the results with you, but aloud the question was, which of the following services is your organization currently providing remotely? Of all of the options, the most is 74% said access technology services. The others, 68% said vision rehabilitation services for seniors. 36% said job readiness training and employee services for adults. 32% pre-ETS and or transition services. 36% said services for school-aged children. 32% said early intervention services for infants, toddlers, or preschoolers. 38% said orientation and mobility services for any age group, and 38% again said low vision services.
Thank you, Ben. So no surprise there that the most common service to be delivered remotely is access technology services. I think most of us have been doing that for some time. There is a terrific video that AFB, it was a session that is now available as a video through the American Foundation of the Blind, and ACVREP is collaborating with them on continuing education units. That was provided by Rachel Trinkowski. Am I saying her last name correctly? Yes. She is an access technology instructor, but her webinar, her session includes information beyond that. So that will be in the information that you're emailed. If you haven't seen that yet, I want to give a big shout out and promotion for that and encourage you to do that. All right, so great. Let's stop sharing the results of that poll, Ben, and I will ask you to share the next poll that we'd like you all to respond to. So this one is, how satisfied are you with the effectiveness of remote services that your organization is currently offering? So if you're not offering it, you don't need to respond, but if you are, give us some sense of how you feel about that. And then next, I'd like to introduce another longtime friend and colleague of mine, of ours, and that is Kathy Zeider. She is the president and CEO of ACVREP, another string of letters. We have a lot of those in our field, don't we? Yeah. VisionServe Alliance used to have a name like that. It always gave me a kick. So I'm happy that we're VisionServe Alliance. ACVREP is not that hard to say. And Kathy, if you wouldn't mind when you speak, just let our listeners know. I think most of you know who ACVREP is. If you don't, you need to. So Kathy, you can cover that and also share a little bit about what ACVREP does for our field, critical organization, and tell us how it's involved in the development of standards for our professionals, our certified professionals, and the work that's currently being done regarding inclusion of remote or virtual services. So Kathy, welcome.
Thank you very much, Lee, and welcome to everyone who is attending. Thanks for this opportunity to, again, a call to attention of the field, hopefully the important role that we're playing in the quality delivery of services. ACVREP, Academy for Certification of Vision Rehabilitation and Education Professionals, which is why we use ACVREP and not the full name, that we are at the organization of ACVREP. We're the process experts for certification. We are not the subject content experts. So for every certification we have assembled subject matter expert committees, usually somewhere between 12 and 14 professionals in the field. We put out a call for applications when there are openings and look to ensure that each subject matter expert committee is diversified in terms of geography, the client served, anything from babies to older blind, so that there is a full representation of the field. The subject matter expert committee works to put together the scope of practice, the body of knowledge, the applied competencies, and very importantly, the code of ethics. When we're developing or updating certifications, we're in the process of updating the COM certification now. Any updated certification criteria is posted for public comment to the entire field. And then everyone who is certified in that particular area receives an email also directly from us with that criteria, and then have the opportunity at a special email address to provide comments on it. Those comments are taken very seriously, both by the subject matter expert committee and by the ACVREP Board of Directors. We encourage, and we post them on our website because we encourage the distribution to consumer groups as well. And in fact, when we were developing the CADIS certification, it was one of the largest consumer groups that took the time to make some very constructive comments about things that they felt would improve that certification, which we included in the certification, and feel that it's much better because of that. One of the reasons that we're looking very in a focused way on remote instruction at each one of our subject matter expert committees is because of concerns that have been raised with ACVREP, both by agencies and by individual certificants. Individual certificants are bound by their code of ethics. They're subject to complaints being filed against them and the possibility of losing their certification if a complaint against their adherence to the code of ethics is successful. So they've all been taking this very seriously during this process. There have been concerns raised that some individuals who are newer to the field may be a bit overly confident in what is safe and effective to teach remotely. So the COMS Subject Matter Expert Committee last week, and I believe it's in the Dropbox or Google Docs that VisionServe Alliance has, but it's also posted on our website. They wrote a letter to the profession providing some general guidelines about what they felt were effective and safe guidelines to use for remote instructions. We all feel that, as they say, the cat is out of the bag, and you can't put remote instruction back into the bag, so it will be a state-of-the-art going forward. The VRT, Subject Matter Expert Committee, is meeting within about the next 15 minutes, and we'll be looking at their code of ethics to see if it needs to be updated relative to remote instruction, and they will also be doing a letter to the profession with their guidelines. We'll then hopefully next week convene the low vision certification committee to do the same thing. Again, assistive technology always presumed remote instruction, so there's nothing further that they need to do there. Rachel Sessler-Trinkowski, who is just one of the most skilled professionals in that field, not the only one, but certainly one of the most skilled, has recently done 2 sessions free on YouTube for using Zoom with JAWS. So that can be very helpful as well, and VisionServe Alliance has that link to provide to you as well. Thank you very much for the opportunity to update you.
Thank you, Kathy. Appreciate that. I want to just ask both you, Kathy, and Sylvia, from the conversations you've had with the numerous members of our field working on this, what concerns, if any, do you have with the provision of virtual services?
One of the things that I will say that has come up in our area is ensuring that there is a standard that all of the professionals understand. So some who have been in the field longer may be uncomfortable with remote services, not as familiar with the technology. Those that are newer to the field, who are very comfortable with technology, may not have the perspective of understanding the best safety requirements, especially for orientation and mobility. using untrained third parties, family member, or as someone at the site who is untrained and unable to step in and provide that safety quickly if needed during remote instruction. So I think really the most important thing is, as quickly as we are able to develop these broad standards so that everyone feels comfortable, and agencies in terms of your own insurance risk management feel comfortable, because I think that there is potential there to make sure that insurers are on board with the direction this is going.
And as a CVRT, I would say that yes, safety is the number one issue that we are concerned about as well. And that safety of both professionals' liability, their reputation, and the organization they work with or for, and safety of the consumer. And really being able to assess realistically what can be taught. And that might be a client by client situation. I think there's probably more that can occur with a client who has been a client already, and you're familiar with them and you have rapport with them and you know what their capabilities are. But when you have a new intake, I think that there's probably a line that you're going to have to draw. And so, yeah, I would also add that communication is a really interesting big challenge that has come up across the field. So many people are used to observing, is the person performing?
Mhm.
And now if they only have a person on the phone, they're not able to observe. And
yeah.
their instruction is also impacted. So one of the things we're finding is that having very specific lesson plans where the instructor has ahead of time performed the task themselves and written down exactly what they need to say is really something that is more effective, and not trying to add too many things, too many elements into a lesson. So yeah, I would say safety and communication.
Awesome. Thank you very much. So, Ben, can I ask you to share the results of our second poll?
Absolutely. So this one had a few less options, which is always nice. But so how satisfied are you with the effectiveness of remote services at your organization? The large majority, 53%, said somewhat satisfied. The next largest was very satisfied at 27%, and then having some concerns was 20%.
Thank you. I'm not surprised by these results either. I think we're still learning a lot, and we recognize that we have to innovate, otherwise no service is provided, but we want to do it the correct way. We want to do it properly, as some of the things that Sylvia and Kathy have mentioned, so we're still figuring this out. Thank you very much. Keep those questions coming in chat. I do see one, and we will ask that question very soon. But I'm going to ask Ben now to share our third poll, which is, which of the following types of professionals does your organization employ in the remote delivery of services? So if you let us know which of these types of professionals are involved in remote delivery, that would be great. All right, so next we are going to open it up to your questions and comments. We'll take those that have been posted in chat first, and then we'll go from there. So I'm Wendy, I'm just going to go ahead and ask Sassy to unmute yourself and ask your question. Are you there, Sassy?
I'm here. Sorry, I was in the chat window reading.
Yep.
Too many things for a screen reader. So my question has to do with social distancing. This affects everything from human guide to being able to safely observe. This is going to be a profound change for our field. How are we figuring this into what we are putting forth in terms of comms guidelines and information that's going out to our organizations right now? This is critical.
Boy, that's a great question. I'm going to first ask Sylvia to respond to that, and then Kathy, if you have any response, would like to hear from you as well.
So interestingly enough, Sassy, who I think is, by the way, brilliant and could be on the panel for sure. I had a doctor's appointment on Monday, and it was actually a dental appointment, and the person met me at the door. And of course, I needed sighted guide, and they provided sighted guide to me. No questions asked or anything. And I thought that was pretty interesting. And I was really glad, because even though I had my cane, this is a very unfamiliar area. And now more than ever, we're trying to be really cautious about people's space. I think it's going to be incredibly challenging to figure this out, because as a person who's blind and has taught, I'm used to hand over hand instruction to really figure out what people are doing. I think it's going to be incredibly challenging. So I don't know if you have any ideas, Sassy, but feel free to share.
Yeah, I do. I think as a person with a background in science, and as a person who is extremely immunocompromised myself, human guide is not an option for me at this time anymore, at least until we have better control of this. And so I've been thinking about this long and hard for myself, let alone the community that I serve. And, being able to give guidelines on how to estimate social distance using cane length. Let's look at a basic triangulation mathematical formula here. But this has become an issue that has been brought up in news articles. How do blind people socially distance when those X's are being put on the floor in stores? This is going to be an advocacy effort. This isn't just a set of guidelines. This is going to need leadership. This is going to need to hit retail trade groups. This is going to need to hit big healthcare facilities. This is going to need a widespread national conversation, because what we're seeing come out is all visual. And we need to hit this with the same accessibility advocacy effort that we would anything else, and say that's not good enough. We need, things tactily on the floor, or we need a public campaign that says, blind people are out there too, and we have to walk among you, and we still need to maintain social distance. Not every one of us can walk up and take a sighted guide when it's offered. I wish that was a possibility, and I'm glad that you did get that opportunity, but there are those of us who can't. And so we need to, this is a massive issue for VisionServe, I feel, that needs to have really critical attention right now.
That's a great point. And I think teaching people how to communicate as well. And I saw you post about that the other day. Teaching the world to communicate with us, really critical. Right?
Yeah. Talking about it, talking about what 6 feet away sounds like, talking about distance of cane tip to foot to shoulder height, talking about, and I think these are things that can be taught remotely in a lot of senses, talking about what it's like to maintain distance and how to ask, self-advocate asking, am I distant enough from you? Can you direct me to where I would be socially distant? Can you give me verbal directions to get to an office? Can you give me verbal directions? It's going to become a mantra in our community.
Awesome. Well, duly noted, Sassy. I agree with you. I think this is an issue for VisionServe Alliance. Thank you so much for sharing that. Deborah Gold has her hand raised. You have a response to this conversation?
Definitely. I think in part, Sassy's points are really well taken, and we've been talking about them quite a bit up here in Canada as well. I think that we need to think about the implications of how slowly the digital solutions have been moving and what role could be played in getting those to go faster. As well, the solutions that we have, like IRA, and I saw that Paul is on the call, are great, but they can be expensive. So we need to figure out, I know there's some talk in Canada about a new role for Be My Eyes. Those apps, like everything else is sped up. I think the development of the digital way to help blind people get around, noting what's in the environment for them, including markings on floor, where the hole is in the plexiglass so that you can pay, and so on, is something we need to be discussing, because it all needs to move and will move a lot faster if we push it somewhat, because it's moving faster on other fronts around AI as well. So that was my comment in response to that. And the other thing is that I think we also need to figure out, we need to take a really good look at the risks of it that are out there, and the best way to mitigate those risks so that people can move around. So if mask on both people and gloves on both people provides for sighted guides safely, and we don't fully know yet, then that will be great. If not, then we have to move, in other directions. But I think we do need to not, as Sassy pointed out earlier, not act out of fear, but based on what we know, and what we know is growing every day. So there's that. Thank you.
Awesome. Thank you very much, Deborah. So we will not have time to go to the nth of all these conversations, so I'm going to move it along, and we will keep this in our back pocket and bring it up in subsequent calls. I think it is an important issue. But right now I'm going to ask Ben if you wouldn't mind sharing the results of the next poll.
All right. Well, our question was, which of the following types of professionals does your organization employ in the delivery of remote services? A whopping 80% says access technology instructors, no surprise there, followed by O&M specialists at 72%, vision rehabilitation therapists at 63%, low vision therapists at 35%, occupational therapists at 48%, certified occupational therapist assistants at 17%, teachers of students with visual impairments 37%, and early childhood specialists 37%.
Thanks, Ben. We just wanted to sense, we realize there's probably other professionals that are involved in this too, but Zoom polling only gives you 8 choices. So we had to limit it to that. So thank you for sharing that information with us. Wendy, do you have another question for us?
I do. This question comes from Jolie Morgan. The question is there a repository of remote VRT and O&M lessons?
We'll ask Sylvia and Kathy to respond first, and then if anybody has any other suggestions.
So actually on our community of practice at oib-tac.org, we have, prior to this, we had a lot of resources. We have the lessons for living on there that were created by AFB, but we are in the process of significantly revising those, especially to really make the language more clear so that literally an instructor could read them to a client, or a client themselves could read them and follow them exactly. And we're planning to get those. They'll be uploaded to our website soon, but we do have the old versions are up there now. And we have lots of other curriculum up there as well. But I think those lessons for living are probably a great place to start.
Thank you. Kathy, anything additionally to add there?
No, we do not have any detail on lessons.
Fair enough. And we're in the process of that. If any of you have other resources for this, will you please share it in chat, and we will share it with the group. It's
And-
probably, go
And
ahead,
can
Cindy.
I ask that if you want to share with the world, send them to us. We would love to post anything you have so
Yeah.
that people don't have to recreate.
Yeah, that's terrific. Thank you very much. So one last poll. Ben, will you share our last poll? When
away it
is
goes.
your, thank you. When is your organization planning to reopen facility-based services? And there are several choices there. We're interested to know. We know some states are moving towards that. So if you would take a moment to let us know where your organization fits in that scheme. And then, Wendy, do you have another question for us?
I do have another question. This question came from Donna Sue Sullivan. Are conversations including the use of learning media? She is specifically asking about for adults, assessing adults and understanding sensory channels can have significant impact on distance service delivery.
So again, I'll ask Sylvia and Kathy if they have anything to share there. And if not, then I'll open it up to the group. Does anybody have a comment on that? But Sylvia, you first.
Am I on mute?
No, you're good.
Okay. We have not gone that far in. We've started, we don't provide any direct services where we are. We just gather data and have lots of conversations with people nationally. So we have not, but I think that it's important that we do find a way to assess that. Maybe someone who's on has some thoughts.
Yes, is there anybody, if you, as a participant, have a comment about that or something to share, please raise your hand. I'm not sure if everybody knows how to do that, so you can just unmute yourself and say something. And that might be, you might win the prize for the most difficult question, Donna Sue. So we need to address that. We'll note that as well. Thank you. So
We have another question.
Yes, please, Wendy.
From Harris Rosenwag. Forgive me if I'm not saying your name correctly. The question is any organization providing remote AT/computer training in groups?
So it's Deborah here. I was going to answer on the chat, but then it turned out I sent it privately to the last person I chatted to privately. Yes, we have run a Microsoft Soundscape group, definitely, as a group using Zoom, and it went quite well. We did not get to the part that we usually do where they get to practice Soundscape, but we got them as far as as the ability to at one point practice. They definitely got familiar with the app. We run, our typical way to do it would be to run the theory for a couple of hours and then get them in smaller groups to practice using the app with O&M instructors and AT instructors co-teaching that course. So we have a ways to go, but we've definitely attempted, and there's a plan to launch more group classes for AT as well.
Great. Dina.
The Carroll Center has been running group Zoom instruction specific for instruction around using Zoom on your PC, not your iPhone. And we make sure that before the class, it's only like a 3-hour class. Before that happens, people already have their Zoom accounts and they're working. It's the only way that we can do that kind of class.
Lee, I will add, this is Sylvia. One of the things that we have found from the data that we have gathered, which we've had quite a number of organizations submit data to us, is that group size does matter. If you get beyond 5, it really does seem to deteriorate from there. Shorter, more frequent lessons limiting the content of the lessons, kind of like Deborah said, you can only get so far. You get much less further in the virtual environment than you seem to get in person. So those are some things that we're definitely seeing crossing all of the things that people are providing to us, of what's working.
This is Sassy. I'll back that up 100%. The smaller you make the lesson, the more bite-sized you make the task that you're focusing on, the easier it is gone. We have at NAVI have been doing group tech lessons on tech in the kitchen, lighting, low vision focus on Zoom, and a couple of other low vision focused and now screen reader focused things, and a beginning lesson together on voiceover for iOS. And again, you know, micro steps is kind of the way, just more frequent lessons with less content. And then I also know that Chancey Fleet is doing group, not necessarily lessons, but info sessions through the Talking Book Library in New York, usually on Saturdays. The Tech Together group run by Erin Lordson out of Lighthouse for the Blind of San Francisco is still going on. So there are a lot of tech programs out there that are still doing things and taking things online. And largely I'm seeing them either go toward kind of those micro bite-sized pieces like that, or information-based, you know, comparison of technologies that are out there right now. I saw one go out for comparison of online shopping for grocery delivery or things like that.
Hi, this is Harris. I wanted to chime in. Hi, Dina. Good to see you. Just curious, were any of you doing any formalized Microsoft Office and AT training using Zoom in groups?
Beth,
That's our focus, actually.
Thanks, Harris. Beth has had her hand raised. Is it relevant to what Harris just said? If so, unmute yourself and chime in.
It was relevant to the question before, just about access technology programs through Zoom and remote. We've been finding a lot of what was just said. We've been finding small group sizes, about 2 to 3 people, to be the most efficient. And we've had to break them down sometimes from rather being one long lesson a week. We've had it broken down into 2 lessons a week. And we've found that to be a lot more effective. So just reiterating the points that they made.
Great.
Just a real quick, I'll put my email in the chat. If anyone who's wanting to do it, wanting to attempt a group AT training with, say, a Microsoft Office or other topics like that, please email me. I'd like to talk to you.
Great.
I'll put my details in the chat.
Awesome. Yeah, please connect with each other. So Ben, will you please share the results of our last poll?
Absolutely. Haven't talked in a while, excuse me. So when is your organization planning to reopen facility-based services? I think we're all in that unknown spot. So at 60%, the responses were unsure. Up from that, we have 24% said sometime in the next month, 30 days. 13% said sometime in the next 3 months, and 4% have said they have already begun offering facility-based services.
Thank you very much. So yes, we're not quite there yet, but it sounds like a lot of you will soon be having to cross that bridge. We'd like to know what we can do to help you there too. I wanted to mention that there was a discussion or a question at one of the Spiel and Steels about accessing PPE for your staff as you reopen. And many of you have local resources. But if you are having difficulty locating a source for PPE, there are a number of Ability One associated organizations who are offering that, and I'm happy to share their contact info with you. Just send me an email, send Wendy or Ben or I an email, and we'll get that information to you. One of them is the Virginia Industries for the Blind. So they've already offered that. You can just go on their website. They have a pretty good selection, and they'll work with you to do the best that they can on pricing. So it is 3:51. We have eaten up the better part of an hour. I just wanted to move into conclusion to talk to you about a couple of things. We are intending to have this call on a weekly basis for a while. And so when you register for this call, you will continue to get notices of this. Anybody who is a program leader in the field of vision rehabilitation or vision specific education is encouraged and welcome to join this call. You don't have to be a member of VisionServe, so please spread this information to your colleagues. We are not necessarily expecting everyone to be on every week, but it's an opportunity to keep the dialogue going. I would like to know if you would like us to take a deeper dive in our next week's call on a specific service or population group that you are serving. We can do that, but we need some feedback from you. So you can enter it into chat now, or since we're going to be closing in a little while, if you missed the chat, if you could please send us an email, give us your feedback on what you'd like us to focus these calls on so we can have the right expertise and guidance. And also, what can we do to make this call a higher value for you? We're really trying to meet the needs of the field as we go through this extraordinary period of history. So I will ask for one last final question before we conclude. Anybody have one? Wow, I never thought I'd live to see the day when we have 75 people from our field and no one wants to say anything. That's I'll take it though, if that's okay. We don't have to talk for no reason. Oh, wait a minute, Ben. This could be your opportunity for comic relief.
Well, we did have a couple of comments come in there, Lee.
Okay, well, sorry. Never mind, Ben. Wendy has a couple of comments to share.
Yes, someone is asking, would like covering compliance via distance, Donna Sue Sullivan, and then also discussion around summer youth programs, those two.
Yes, and talk more about O&M for preschoolers and elementary. I'm seeing a lot on O&M. So that I think is a no-brainer that's the most challenging that we have to figure out. So keep those comments coming in, and we now have all of your email addresses, so we will update you this week with what the topic will be, you know, the focus of it. And we hope that you will continue to share resources with us and ideas, and we will learn together. I want to thank each and every one of you for your choice of vocation. It takes a village to do what we're doing. And, you know, my personal background is I have a son who is blind and has multiple disabilities. So my first entree to this field was as a crazy mom trying to advocate for her son. Some of you probably dealt with me as a parent years ago, and I'm sorry. I'll just apologize up front. But I so appreciate what each and every one of you do. Hang in there. These are challenging times.
Yeah, if you guys have any comments, questions, concerns, issues, any kind of follow-up that you need from the meeting, send us an email at info@visionservealliance.org. I'll put that in chat here. But reach out to us. Let us know if you're having any issues accessing any functions in Zoom, or any of the resources that we're going to be emailing out, and we'll get back to you quickly.
Good.
And send me what's really, really working well, so we have data points to use for standards.
That's right. That's what it takes.
Yeah,
Thank you all.
Doesn't have to just be negatives. Positives, we'll take those too.
Well, I really want positives, actually. That's what I really want.
Okay, great. Thank you. And we hope to see some of you back next week.